Schimmel at ASCO 2011, and our discussion continues now with some of the unsung heroes in oncology, patient advocates, and the ones that really now are becoming so instrumental in aligning the efforts of the research community, reaching the patients, energizing young researchers and physicians. And I'm joined by Cara Tenenbaum, Vice President for Policy at the Ovarian Cancer National Alliance in Washington, D.C. Hi, Cara.
Hi, thank you for having me.
I'm so pleased to talk to you because I want to focus on what you're doing to highlight the work of young researchers and helping to propel their research, and also even getting patients to know how they can connect on behalf of clinical trials and perhaps a specimen collection and all of that.
Well, we know that the statistics on ovarian cancer have not really, the needle hasn't moved in a number of years, and we know that research is the only way that's going to happen. So there are a number of things. First of all, we advocate for increased and sustained federal funding for ovarian cancer research. So the National Institutes of Health, the Department of Defense actually has a research fund. 90% of nonprofit ovarian cancer research is funded by the federal government. So that's number one on our agenda. Second is getting the research done. So getting people involved in clinical trials, making sure that they know what the myths and facts really are around that. We have a number of resources on our website. We do webinars. We work with a number of organizations that are really focused on making sure that patients know and have information about clinical trials. We also publish something called the Teal Journal. Quarterly, we bridge the gap between the science and the patient. We explain in lay language the breaking science, what's happening, help get researchers to answer people's questions. We're going to have one in a couple weeks, and the Ask the Expert focuses on nutrition, which we've heard a lot about here. Should people take vitamins while they're taking chemotherapy? Can we do anything prophylactically with nutrition to prevent ovarian cancer? And these are questions that people have, and they need an expert to help answer. We also encourage people to think about getting involved in clinical trials even before they're diagnosed with ovarian cancer. If you have a family history, perhaps you want to enroll in a screening trial so that you have increased care, and that clinical trials are an option along the whole continuum of care.
What do you do on the professional end with researchers, visiting laboratories, raising awareness on the research component for ovarian cancer?
Well, part of our work is translating this information. So we visit about 4 labs a year and write them up for our newsletter, our Teal Journal. I was just visiting a company up in New Jersey that has a commercial product for a different cancer type, and then visited a lab in Pennsylvania, an academic lab, to see what they were doing. We'll be publishing that in a couple of weeks, like I said, and we want to make sure that people know what the clinical trial is, how they can get involved, talk to their doctor and see if it's right for them, because it's important. And we don't endorse any specific trial or drug or treatment, but we want to highlight some things that are interesting and new so people are always excited about clinical trials, because there is always something new happening.
If someone wants to be in touch with the organization, whether it's for clinical information or psychosocial support, what's the website?
The website is www.ovariancancer.org. We have a clinical trials matching service on there. We have resources. We have fact sheets. We have an online message board, and we're always there. The phone number's on the bottom of the website. They can call and pick up the phone, and a real person answers it.
Thank you, Cara. I just wanted to capture a few minutes with you because this is Advocacy in Action.